Well, thank you and very good afternoon, ladies and gentlemen. We are on the last session of the today's proceeding, and I bring the greetings to you from the Central Bureau of Health Intelligence of the Government of India. This is the national nodal institution for the whole country, and we bring out the national health profile for the whole country, which serves as a reference document. Now, dear friends, I'm really happy to be always associated with the e-health, in fact, with e-India. And my association has been right from the since it started in the year 2007 in Delhi, and now we are the fourth year of the e-health. I'm really happy to see that how we are growing and successfully we are moving. I really compliment the organizers and the entire team of e-health for their successful and hard work to take the entire forum to the whole country. Now today's this session in the afternoon has been really designed on a very, very crucial aspect, and that is on the reforms, transformations, the performance, and we need to chart the blueprint for the future Indian healthcare. I would like to spend a couple of minutes because these key words of reform, transform, and perform, I think we must understand them. Each one of them carry a very, very detailed, in-depth meaning, and after each word, a lot of actions are hidden. That's what will guide us for the future. Now, we have been really doing a lot of reforms in the country, and the Central Bureau of Health Intelligence has started a website called Health Sector Policy Reform Option Database. It contains almost 250 reforms in the entire health sector, and the entries are from all the 35 states and union territory of the country, and they are focusing on almost 15 management issues which are concerned with the health. So I really hope that this group can look into this website, www.hsprodindia.nic.in, and you will love to go through it. And the whole idea is to share the experiments, both failures and success, so that we become wiser when we plan for anything new. And I really welcome if more entries you can really suggest so that we can upload the data. Now, the country definitely has moved into the success of transforming. And the example is very clear that the new modern ICT tools have been widely involved in the country. And the government of India is really giving a top priority for this purpose. You all know that at least 3% of the budget need to be spent on ICT in every ministry, every department, every institution, every program. Now, this really brings a great revolution. We have already reached right up to every village, and the centers are being establishing for every panchayat. The National Informatics Center, which is put into every ministry, every state and district level, is really doing a wonderful job in that. Now, I was just wondering that the transformation, of course, is taking place, but probably we need to be still more fast. Another word on the healthcare delivery. And I find my colleagues, the members of the House here from all different walks of both private and public sector. Now, dear friends, when we talk of healthcare, we definitely want everybody to be healthy. And for that purpose, we are focusing on various preventive and the promotive care. That becomes a primary health care. But if one suffers from the disease or ailment, enters into the need for the care, and that starts a curative service as a secondary care. And still, we take efforts that the secondary care prevents the complications, or if we still go into the complications, we go into the tertiary care, which needs speciality and further super speciality. Lifestyle diseases are really stepping in our country. The injury because of the road accidents are definitely becoming the cause of concern for us. We are also the nodal center for the injury surveillance in the country. And all these cares, that means the primary, secondary, and tertiary, they form inbuilt component of the healthcare delivery. So let us not ignore them. And in India, we have a very well organized healthcare delivery system right from the most peripheral till the national level. And I'm sure you know it. The first contact point above the village is the sub-center for 5,000 people and 3,000 in the difficult area where we have the trained multipurpose health workers. And this is almost 140,000 such sub-centers in the country. Up is the primary health center with the doctor contact, almost 23,000 and odd. And then further up at the block level is the community health center with 25 to 30 beds with the specialization on the obstetric, gynae, pediatrics, medicine, surgery. It becomes the first referral unit. And then we move up to the district level where we have the district hospital of 200 to 500 beds depending on the size. And then we move up on the state and various medical colleges and so and so. Now why I'm telling this is there is a need of challenge in the reforms and transformation at the peripheral level. I was just now talking to my colleague from Nigeria here. They said still at the most peripheral level, ICT has not yet reached in operation for handling the records. We are still paper-based, and we are still finding difficulties, you all know. So this becomes a challenge. Of course, from the district and above, India has gone into the ICT mode or the computing-based mode or the web-based mode, but still we need to. So this itself is a challenge, and he was telling that people are registering to go into ICT in the primary care because they say, unless we don't make the paperless efforts, we should not leave the paper. But the issue is, unless you don't start the movement on the ICT, you cannot become paperless. So this is one such example of transformation. And today we have got a panel of very distinguished experts with us who will be sharing these experiences. And we do have, you can appreciate that probably this was the largest panel of 8 experts. And I was seeing in the program, none of the panel is with this number. But unfortunately, 2 of our experts could not make it. That is Dr. Shakti Gupta and Dr. Arna Surjadi from WHUCR office. So we are the 6 experts with our panel, and they're all very distinguished. That is Dr. Ajit Nagpal, Dr. B.K. Rana, Dr. Mahesh Reddy, Dr. Bala Subramanian, Dr. P.S. Ramkumar, and Dr. Rama Chandra Lele. The program and their designations and their institutions right in your hands in the program. And dear friends, I hope you will permit that we can have the discussion at the end when all the experts have made their presentation. Because in between, we may interrupt and take. So kindly keep your questions, queries, and suggestions ready at the end. And we must spend about 15 to 20 minutes at least for the discussion. Then only the whole idea of a panel will go. Now, my colleagues as an expert will kindly permit me to kindly frame the limit of the speaking. We have to keep a maximum of 7 to 8 minutes. Because keeping the time in constant, and I know Dr. Ajit has to pick up his flight also. So in any case, we have to start. So I will not take any more time, and kindly permit me to start. And I really request and invite Dr. Ajit K. Nagpal for his presentation, please.